Currently, the healthcare system is increasingly taxed by decreased budget and increased health expenditure, with only about 10% of the population accounting for 65% of the total healthcare expenditure. So cancer pain accounts for about $243 billion annually in healthcare costs. Chronic pain accounts for about $560 to $635 billion, which is more than diabetes and heart disease combined.
When patients feel that their chronic pain needs aren't being fulfilled by their healthcare providers, they resort to their own methods, which usually are overutilization of the ER and self-medication. And I think this use of technology through the phone app is something that we need. Our clinic created a personal pain monitoring phone app, and some of the features in this phone app are a daily assessment feature where a patient can record their pain levels, interference levels, and anxiety levels over time, which both patient and provider can see. And the other feature is a messaging feature, and it's a two-way messaging feature, so a patient can send a message and get a response back from their provider, thereby improving patient-provider communication.
With this app, we are trying to get information more readily accessible to the treating physicians of pain patients so that they're able to make more informed decisions more frequently and that the patients feel more involved and included in the decisions that their provider makes, ultimately resulting in a reduction of healthcare utilization and an improvement in that patient's pain.
Without the center, we could not have possibly provided compensation for the patients in the study. We wouldn't have been able to hire research assistants for the study.
The app wouldn't have been possible without the center, from all the stages of development through the current study that we're going through to test its efficacy. It made everything possible.
Technology is so readily available nowadays, and we are desperately in need of new approaches to improve the healthcare system. And I believe that these new approaches lie with technology.
This is just a starting point, but I think in the future it will absolutely bloom and result in increased coordination of care across a wider amount of domains.